from the station that's on your side. Awarded the Regional Edward R. Murrow Award for Newscast Excellence. This is Channel 7 News Daybreak.
6:23 is the time. You've probably heard for years now that choosing white meat over red meat is the healthier way to go. Well, there's new research out that the chicken over the steak debate you might need to hear, because it's going to change that perception. Joining us this morning to break it all down is Baptist Health's Dr. John Allen Cockerell with Sherwood Family Medical Center. So who published this study, John? John, thank you so much for joining us.
Sure.
This was something I know that's very recent. I read it I think last week. What's it been like in the medical community? How's it being absorbed, and how did this study come about?
Yeah, so it's been widely publicized, and I think it does make some good points, but I also think some of the issue behind it is saying white meat is just as bad as red meat. So not entirely true there. So breaking it down into its parts, who developed this study, you know, give credit where credit's due. The Journal of Clinical Nutrition is who published it. It's a reputable source. Came from CHORI, C-H-O-R-I, so the Children's Hospital Oakland Research Institute. I want to get that right.
That's good. That's impressive.
But they did a really good job of evaluating the LDL cholesterol, so the bad cholesterol between white and red meat, and found really no statistical difference.
Really?
So that was what woke everybody up to think that, you know, in this study at least, there was no difference in white meat versus red meat in raising your LDL or the bad cholesterol. But I will say this too, and I know we got to move on. You know, there are health benefits outside of the LDL cholesterol that white meat have over red meat.
Like what?
So in terms of weight loss, right, red meat has a lot more fat content as well. So there are things to think about, not just the LDL cholesterol, but the whole picture of what your protein sources are giving you.
Okay, but from a heart perspective, you know, we talk about cholesterol when we're talking about heart issues. Heart disease is the #1 killer in our country. So does that open up some eyes there, or maybe change the perception a little bit?
I think so, you know, and there are non-meat sources of protein also, right? So that's important to
know. And there's more and more, it seems like, these days than ever, right?
Well, and there's so many more resources now. People are open to different dietary changes. So yeah, it has changed a lot. So beans, nuts, legumes, those are great ways to get protein, right? And vegetarians and vegans that I've helped out with in the past, or tried to help out with in the past and treated, you know, they've been onto something there, I think. So I think it's more about knowing what you're putting in your body, right, and being aware of that. I know it sounds cliche, but it's true. And if you could mix in some other non-meat protein sources, I think your overall heart health, to your point, is going to get, you know, much better.
Okay, and some ways to treat high cholesterol for those who are dealing with it right now before we go?
So yeah, so there are some medical treatments available, and statins are the big name, I think, in cholesterol treatment, but that's not the end-all treatment too. So there are ways even outside of statins to, like we talked about, improve your diet, exercise, lifestyle, you know, modifications, changes there. If you do have to go on treatment, statins are one of the mainstays, but not the only thing that we can use. So if you're out there and you're looking at pill bottles, atorvastatin, rosuvastatin, there's all these different kinds of statins. They each work a little bit differently, so it's customized to the patient on who needs cholesterol meds and who doesn't. So just because you have high cholesterol doesn't necessarily mean that you need statin-type medications. So just talk to your doctor. They'll come up with guideline-based, hopefully guideline-based therapies for you. Figure out what you need.
Might just need to go to the produce section and spend a lot of time there, right? Yes, and then go for a run on the beautiful trails. Thank you so much, Dr. John Allen Cockerell from Sherwood Family Medical Center this morning. If you have any questions, you can always call the Baptist Health Line, and of course more resources are available on baptist-health.com.